For the disease process, I have chosen to talk about diabetes. Diabetes is a disorder of how the body regulates blood glucose, and its disease process depends on the type. For type 1, the autoimmune destruction of beta cells type 1 occurs when the immune system mistakenly attacks and destroys the insulin producing beta cells in the pancreas. This will lead to either little or no insulin production. Without insulin, glucose cannot enter the cells, so it will build up in the bloodstream. Cells will starve for energy, while high blood sugar causes dehydration and tissue damage. For type 2, insulin resistance and beta cell exhaustion, type 2 will begin with insulin resistance, which means the body cells will stop responding normally to insulin. The pancreas compensates by producing extra insulin, and over time, the pancreas becomes exhausted and cannot keep up. Blood glucose rises and remains chronically elevated. Common symptoms for type 1 and type 2 include excessive thirst, frequent urination, increased hunger, fatigue, low energy, blurred vision, slow healing cuts or infections, unexpected weight loss, tingling or numbness, dry skin, and frequent yeast infections. For type 1 specifically, it comes on suddenly. You'll experience rapid weight loss, fruity breath odor, nausea or vomiting. And for type 2, it is gradually onset. You'll get darkened skin patches, increased infections, tingling, or nerve pain. One of the organ systems that is affected is the cardiovascular system, which is heart and blood vessels. High blood sugar damage and blood vessels and the nerves that control the heart. You'll experience increased risk of heart attack and increased risk of stroke. The nervous system, which is your peripheral and autonomic nervous system, chronically high glucose and damages nerves throughout the body. Peripheral neuropathy, atomic neuropathy, loss of sensation. And the last organ system is the renal system, which is your kidneys. The kidneys filter blood, and high glucose overwhelms them. Diabetic neuropathy, kidney damage, protein leaking into the urine, swelling in legs or feet. Diabetes is the number one cause of kidney failure in the U.S. Treatment and management include a lifestyle change. For type 1, insulin therapy is required for survival. For type 2, oral meds is recommended. Insulin may be needed for type 2 if oral meds are not enough. I believe that it equips us by helping us as humans to better understand His creation, alleviating suffering by using the knowledge that He gave us to create medications and to restore what is broken by this illness. All of this is reflected by God's character and purpose for us, His creation. This is supported by the American Diabetes Association Standards of Medical Care in Diabetes, also supported by Zhang, Lei, and Hugh, Global Etiology and Epidemiology of Type 2 Diabetes and its Complications.